Hello everyone, and welcome to the 7th session in the Planet to Plate Festival. 3 days of talks, performances and live events to celebrate the work of the Institute for Sustainable Food here at the University of Sheffield. I'm Peter Jackson, one of the Institute's 2 co-directors, and it's my great pleasure to introduce Hannah Lammy-Mumford, a lecturer in politics here at the University of Sheffield and a member of the Institute for Sustainable Food. Hannah's been working with Rachel Loopstra from King's College London and researcher Katie Gordon to examine the government's response to the COVID-19 pandemic and its impact on household food security in the UK. The plan is that Hannah's going to talk about their current work. Hannah and I will then have a short discussion about government response, and then there'll be a general Q&A. So if you have questions or comments for Hannah, please use the live chat, or you can tweet using the hashtag #PlanetToPlate. So without more ado, over to Hannah.
Thank you, Peter. So I have a short PowerPoint presentation, which hopefully will also provide those of you that are watching with some of the content of our work. So just a little bit about the overview of what I'm going to talk through before we have our discussion. Talk a little bit about rewind to last March and some setting the scene for some of the threats to household food security that we saw at that time. Talk a little bit through some of the responses that we've explored in our research, and then think a little bit about where next and some of the key questions that have been raised, really. So just to set the scene for everybody in terms of where this presentation comes from. So it's the initial findings and a couple of rounds of findings from a project funded by the Economic and Social Science Research Council as part of the UKRI Rapid Response to COVID-19 funding. And we've so far published 2 reports with another tranche of reporting due in the next couple of months. Peter, as you said, the research team is Rachel Loopstra from King's College London, myself, obviously you're part of the team, Katie Gordon, and we also have co-Is from 2 of some of the most high-profile and important NGOs in this space at the moment. So Sustain from the Alliance for Better Food and Farming, Simon Shaw's working with us from there, and Neil Cooper, who is the Director of Church Action on Poverty as well. Broadly speaking, there's 3 areas of focus. So we're looking at the national interventions that we saw in response to risks of household food insecurity over that time. We're looking at local interventions, and we're also looking at lived experiences with a participatory policy panel that CAP are working with us on. So if we think back to those early weeks of the coronavirus response in the UK and the run-up and the early times around the first lockdown, we obviously remember the sort of low stocks in supermarkets and issues of food supply as being one of the most dramatic and visual manifestations of food issues over the run-up to and the immediate kind of aftermath of the lockdown. And one of the first things we did in the research was really actually to map onto the FAO's dimensions of food security, some of the challenges that were faced by people in the UK at that time in relation to food security. So those of you that are familiar with this sort of dimensions, we've got impacts on household food access, impacts on the availability of food, impacts of the stability of household supplies, and impacts on individuals' utilisation of those things. So you can really see from this table how all 4 dimensions were impacted for people in the UK and different groups in different ways as well. So obviously income losses affecting economic access, physical access issues, particularly those who were shielding were advised not to go out even to get food, which is a huge physical access barrier. And also those who were having to self-isolate as well. And obviously the food shortages that we saw and the different interruptions that we saw to different projects and other, the closure of the hospitality sector, for example, not being able to eat out at all or as easily, getting takeaways, things like that. And the impact this had on people with special diets particularly as well, and so food safety concerns in the home, people keeping food for longer. So those of you, again, that follow issues of household food insecurity may be familiar with this data, but the Food Foundation collected a monitoring of household food insecurity over this time. And these are some of the these are the findings from this over time. So the first point in this PowerPoint, if you can see in the graph, is actually the Food and You results previous to the crisis. So you can see where food security was at before the crisis. And you can see this enormous jump in those early weeks in early April. Now, it did obviously go down, but obviously stayed considerably higher than rates before COVID-19. So this is showing us that there is clearly significant issues around household food insecurity across the length of time of that lockdown and beyond. One thing that Institute members and those who are sort of interested in these issues might find interesting is that in those early weeks, so in that April round of data collection, about 40% of food insecurity in that sample was actually accounted for by a lack of food in shops. So physical access to food being absolutely critical to that first measure, although obviously less so as those weeks went on and that food insecurity level remained high. So responses then, what did we see? So we saw responses from all sectors at all scales, essentially. So we saw businesses responding, retailers adapting to supply issues, caterers, school food caterers having to adapt to school food provision in the home and outside of school, governments responding at different levels, which I'll talk about, the third sector similarly, and also at more informal responses from communities and neighbourhoods and friends and family in ways that hadn't been present before. So for those of you that may have been following these issues at the time, you may have been aware that the government essentially identified 3 groups who were particularly at risk of food insecurity around that first lockdown. So the extremely clinically vulnerable who were asked to shield and not to go out even to get food. The moderately clinically vulnerable people who were asked to limit their contact outside the home, but they were not asked to shield formally. So they would have been trying not to go out as much as possible, and those who couldn't afford food, the so-called financially vulnerable. So it's quite important in language terms to just highlight here, this is one of the reasons why the project is called food vulnerability over this time, because this was very much how it was conceptualised in this moment by government and other kind of key actors as food vulnerability for various reasons. So I'm just going to touch on a few key ones of the key responses and some of the findings that we have around how they worked and what the rollout was essentially. So charitable emergency food assistance was one of the absolute key responses, front and centre, particularly for financially vulnerable people who couldn't access food for economic reasons. So what we saw here was in the early weeks, those projects, just as every other sector, suffered from food supply issues. Getting food was really difficult. Their volunteer base also suffered because of shielding and sort of the demographics of that traditional volunteer base being affected and mostly staying at home, so having to get new volunteers and work differently, and increases in demand, which we saw actually across the lockdown. From March onwards, you can see that the landscape of provision really adapting. So sort of meal projects that might have been working in the community, like community cafes, repurposed to provide food parcels or meals that people could heat up at home. And also new projects coming up. There were lots of reports of new projects newly starting, people starting up in response. There were new ways of accessing this provision, notably increasing move to delivery of food parcels, where projects might have required people to attend the project to get the food, more and more deliveries. And there was a really big example of furloughed staff from British Gas were taking parcels with their vans around and delivering them to people, and also new referral processes, a new hotline starting up or other ways of accessing it. And obviously the supply and operations having to change in response to social distancing, which was a significant issue. So these projects were really responsive and made extensive adaptations. I mean, the scale of government and other kinds of funding and bulk donations that moved through this system were absolutely unprecedented. There was, it seems to us in our research, really a heavy reliance on charitable emergency food aid providers as part of in the landscape of the response, including in relation to the government response. So they were actually designated essential services right at the announcement of the lockdown. So they were baked into that. And several of the well-established vulnerabilities of this food charity system were exposed. However, the work they did to overcome them, as I said, absolutely unprecedented and extensive. So the second one, which we want to talk maybe a bit later, Peter, about access to food, physical access to food, one of the really sort of unique and different interventions that we saw at this time was the grocery boxes for people shielding. Now, these were national schemes, and that's really important in the geography of this, all of this, to kind of reflect on. They were done across the 4 nations. There was the contract sort of worked similarly in England, Wales and Scotland, different in Northern Ireland, but slightly adaptations in each country. But essentially they were kind of managed by the national government in each 4 countries. In England and Wales, these boxes were for just those individuals in the shielding list. So in principle, in this scenario, if there was one person in a household who was shielding and several others, the box would only have been for that one person. The other people would still have had to kind of source their own food. In Scotland, others in the household could have received food support. That was possible if they'd rung the hotline and sort of got talked through their needs. In Northern Ireland, this is very different because this is a very distinct box scheme. They actually offered a box provision. The National Northern Ireland Executive Government offered a box scheme for those who are shielding but also facing financial barriers to food access. Now, that is very distinct from the other 3. It's important to note that the box scheme was one of several interventions that each kind of government put up, for example, supermarket delivery slot schemes. But they are sort of a standout intervention, I would say, for us to reflect on going forward. So obviously this was unprecedented in scale, speed and complexity in terms of the need and support for accessing food. In Scotland, our participants sort of stressed to us that there was co-production and close working between local and national governments to try and get it as right as possible. However, there were significant limitations that stakeholders reported to us. So the content of the boxes were generally not adequate. There was confusion over who could get it. And often we're finding in our local research that local authorities were supplementing or even supplanting the national provision where it just wasn't sort of working effectively. There's been some evaluation work, notably in Scotland, but really there's not been much published at all in a kind of national level, which is really important to note, I think, going forward. So the school food alternatives then is another one that was obviously and also became increasingly high profile over the course of last year. So, and these varied again across the 4 nations. So in England, there was sort of a food parcel provision or vouchers to families, decided very much at a local authority level. Those of you who were following this at the time may remember that the DfE established a voucher scheme through Edenred, which encountered a lot of problems early on, and there was a lot of work done to try and improve it in terms of its accessibility and how it worked, and it was kind of revamped after a few weeks, and actually the uptake of that voucher system was high, actually they found in the end. In Scotland, we saw there's an interesting trajectory actually, because it was a local response designed by local authorities, and at the beginning there was more food parcel provision, more in-kind provision, and actually across the local authorities there was an increasing move towards cash replacements, giving families cash to buy food rather than giving them food in kind. In Wales, the standout thing here, one of the standout things here was actually that they, because there is a breakfast club provision sort of baked into policy, there was breakfast replacements provided where children were receiving them before. So there was extra money given to families for the breakfast provision, and that's distinct across the ones. Northern Ireland, again, they're very distinct in their response, and actually right from the announcement of lockdown provided direct payments to families centrally from the government. So that's a very standout one. So obviously, as you see, there's a range of approaches. Across the UK, there were concerns raised around the eligibility criteria for this kind of revised provision, and ultimately the reach of the replacement schemes. Were they effective? Were they reaching all the families that really needed it? There's a really important debate here around how the different alternatives worked and which was most effective, particularly around giving food in parcel form, vouchers or cash. So concerns were raised around, with parcels, families having to travel to school to pick them up, the contents not necessarily being healthy or appropriate, and similarly with vouchers, having to go to a certain shop, travelling to that certain shop, and the stigma and restricted choice around the vouchers as well, where in comparison to cash, enabling more choice and flexibility to visit local shops, independent shops that may be more suitable, and to buy ultimately what the family needs. So it will be important because it speaks to wider debates about school food provision, and it will be important to learn from some of these lessons. Okay, so the last intervention then is emergency finance provision. So again, we have some quite big variation across the countries. Now, by emergency finance, what I mean is a government-provided emergency cash grant system for kind of a financial crisis situation. So in 3 of the countries, in Scotland, Wales and Northern Ireland, there are existing systems in place that are funded nationally and ring-fenced in that way. So the Scottish Welfare Fund and the Welsh Discretionary Assistance Fund are 2 examples of that. And both of those had additional funding put into them. Their eligibility criteria was changed and there was increased flexibility in how they could be used. And in both cases, people could apply more times than previously. There was a special fund in Northern Ireland, the Discretionary Support for COVID-19 Fund, which worked in a similar way. In England, notably, there is no national emergency finance scheme. Local authorities administer what are called local welfare assistance schemes, but these are not sort of dictated in their form by government, so they're not required to be cash-based. So local authorities could use, in theory, could use their funding to fund other projects, fund food banks or other kinds of support. Important work is being done by CPAG and others to find out what sort of happens to some of those schemes over time. So it'll be interesting to follow that research. There is actually very limited evidence on the impact of these schemes. So the stakeholders that we talked to that were working in this field have really praised and welcomed the changes to eligibility and additional funding, but ultimately there was a significant concern that there wasn't maybe sufficient promotion, and also a real worry that people who were new to sort of social security systems wouldn't know they existed and wouldn't have actually been able to access the schemes. So it is important to find out quite a bit more about how they worked. Okay, and then just a few emerging findings on the local responses, because there is a really interesting and important geography to how this all played out. And locally, the local space was really, really important. The responses were really varied, but they included, so in a similar way to what we've seen, what we were talking about earlier, the early weeks were very challenging in terms of responding and reacting and operationalising the various ways of working that then followed. And there were lots of actors involved at a local level. Councils were obviously very involved. Often this involvement focused beyond the shielding group. So the government national box scheme focused on the shielding groups. The local authorities tended to focus on those sort of beyond that group, but did in some cases also work to kind of supplant or supplement those shielding boxes. They funded other kinds of food provision. They provided welfare, warehouse support or some sort of food hub scenarios where other projects were able to leave food and distribute it. Partnership and collaborative working has been a key focus in a number of the areas that we have looked at. In-kind food provision certainly was a central part of the response. So food banks, again, at the forefront of responses to economic vulnerability across different case studies. And also examples, we've seen that on the ground to what we were finding at the national level, that projects adapting their operations and new projects popping up. I think after all our hard work, one of the key conclusions is it's very hard to capture it all, particularly at a local level, and particularly some of those pop-up things that came and went. And hard correspondingly to know what worked, essentially. So there are really important questions to look at around what was effective and what we can learn for any future scenarios. And they do, the research really at all scales highlights questions around what the different role for different governments are, local and national, and also the different role between local government and third sector organisations. So there's some really interesting thinking to do around that. So some thoughts for the future then, really, and maybe something we can pick up on in the discussion. I think one of the really important things is figuring out how we don't forget the early weeks of the crisis and what that exposed about the food supply system and food supply issues, and the ways in which those food supply challenges affected lots of different actors, households, individuals, but also food projects and others. And I think it seems a long time ago now, but actually that was a really acute situation. And what can we learn about that, and what can we move forward with? And also thinking, so our work's focused on a household, local, national level, but also the global, ongoing global implications of the pandemic in terms of that the FAO, they have various things on their website about the ongoing impacts. and also the compounding impacts of Brexit and COVID, which obviously we're seeing particularly in Northern Ireland. And so this is by no means sort of over. In terms of access to food, so some of the questions that's raised for us really is how effective were the responses to hunger over this time, and should we be thinking differently for the future? So there's very limited evaluation so far, so that's something that we're going to explore a little bit more, what the evidence base is. What should happen to free school meals? You know, there's been a lot of sharing of experiences of that replacement provision, lots of discussion about that, so where should that go? And what are the legacies of COVID-19? So one of the particular at the local and national level, you know, what are the legacies of this expanded food redistribution network, for example, the tens of billions of pounds that went into that system? Does that lead to a more entrenched food banking system or not? And who should be responsible and for what? So what should national government do? What should local government do? What should the charity sector do? Or what have we learnt from all of this? And really to think broadly around the state's role in terms of income and economic access to food, and also the role of the food industry and other actors as well. It's a really complicated puzzle. And ultimately, if we're thinking about the charity sector, what role, if any, should food banks have, given that they had such a prominent role to play in the response so far? Okay, this is the link to our project website where you can find the two previous reports, and hopefully, and shortly, you will be able to find our local case study work as well. Okay.
Fantastic, Hannah. Thank you very much. And that's a really detailed insight into really current issues. And so we're trying to think about responses and evaluate their effectiveness almost in real time, aren't we, as those events are unrolling. So what we want to do from now is I'll engage Hannah with a few questions and a bit of a discussion about some of those topics we've just raised. We've already had a couple of questions come in, which is great. Please do continue to send in any questions you have. You can use the hashtag #PlanetToPlate on Twitter, or you can use the live chat to submit those questions. And they'll be coming through to me here on an iPad, and I'll then be translating those questions to Hannah. But let's just do a bit of discussion to start with, to sort of warm up for the Q&A. So the first thing I wanted to ask about was what, if any, relationship there is between your current work and the National Food Strategy. So as people will know, the National Food Strategy the first part of it was released last year and talked very much about, one of its main things was about the extension of free school meals. Government, I think it's fair to say, was not keen on that and was then put under a lot of pressure by the campaign led by Marcus Rashford. So the first part has talked a lot about, I think, issues that are very close to what you're talking about, the role of government in relation to free school meals. The second part is due to be published, I think, next month, I think in July. And what I've heard so far, I've been a little bit involved in it in terms of the public dialogues that are going on across the country. The preliminary reports from that are there is a sort of substantial public appetite for change, if I can use a food metaphor, but less consensus about whether we need radical measures or more gradual change. Should we rely on food labelling, education campaigns, or harder fiscal measures, taxation and things like that? So I don't know if you feel there is a relationship with the National Food Strategy, if you've been able to have any input to it, but it seems to me the questions you're asking here are the sorts of things that ought to be covered in a National Food Strategy.
Thanks, Peter. Yeah, I mean, I think there are sort of good links to some of the findings, as you say, and we've engaged with some of various stakeholders over the life of the project. I think one of the important things here again is, maybe that's partly because we've got two geographers here, but one of the things I think is important to highlight is the geography of the food strategy. So it's focused on England. So I think there are some really interesting kind of English dynamics to some of this. You mentioned Marcus Rashford and his campaigns around the free school meal replacements. And it's important to, when this project is focused on the UK broadly, so it's interesting to note the differences across the four nations. And I think that will be something that's really important going forward is what can be learned across the different experiences. So, for example, the Wales, the breakfast club, the breakfast provision entitlement in Wales. In Scotland, obviously, they have a very different approach again to their kind of food and household food insecurity policy. So, what can be learned there around some of those things? The free school meal and school food debate. And it relates to the second point as well about transformation. None of these questions are new. There's been a lively established debate on universal school food, for decades, and big NGOs and lots of research gone into the importance of providing good food and in kind of universal provision. Research on what school food looks like across Europe, thinking of Rebecca O'Connell's work, comparing sort of Portugal, Norway and the UK and the different experiences of school food. So there's a lot that can be learned around those, I think. And as we found, core concerns around the criteria, the means testing for free school meals and actually who's missed out from that. Children with no recourse to public funds, for example. And again, sort of more extended provision of free school meals overcomes that, some of those issues. In terms of the appetite for change, I think, I obviously haven't seen the National Food Strategy, what's coming out or anything, so I'm not entirely sure of its framing. But again, a bit like I just said in relation to the free school meals, I think one of the other issues is these questions predate obviously the crisis and what we've had before. So one of the slides I showed about the food insecurity monitoring showed, there was already a level of household food insecurity before all this. So that showed that before, these problems are long lasting. And actually, I don't know, and this is a bit back and forth, so stop me if it's not sort of relevant here, but also where does a food strategy end and where does it go out to? So taxation of, we're just talking about the food industry there, or are we talking about redistribution of wealth to overcome economic access barriers, things like that? There's very few spaces that the interaction between food, social and economic systems doesn't touch. And I think it is important that those kind of approaches are fully broadened out to people's kind of livelihoods in the broadest sense.
Yeah, thank you, Hannah. It's interesting. I think the phase one or part one of the National Food Strategy was published just after March 2020 and had to be almost kind of rewritten with lots of new prefaces and things to say, as we were writing this, COVID impact happened. And some of the questions that are coming in are specifically about that and how far it demonstrated underlying vulnerabilities within the food system. We'll talk about that in a minute. But I think it's also going to be really interesting to see what comes out in this July phase 2 report, and then what happens next. I think they promised a white paper within 6 months of the publication of the National Food Strategy. So there's definitely a sort of watch this space kind of thing there, I think. So I think you've touched on this second point I wanted to make already, which I'm calling the sort of fragmented political landscape around food. And you focused here mostly on differences between the nations within the UK. That's definitely the case, and you've shown all kinds of unevenness in response. But I think the situation's even worse than that if you think about the way in which food is divvied up, so that the environmental aspects and the agricultural aspects of food are in DEFRA, food safety is within the Food Standards Agency, trade is within BEIS, and so on. Health issues, of course, are separate again. So do you think your research speaks to that, and that a more joined-up approach across government would be helpful? And if it would, what are the barriers to that? What's stopping that from happening?
Thank you. Definitely more joined up and sort of cross-government response across those pillars of responsibility and across the scales as well, I think, is really crucial. Because as you say, ultimately it is very fragmented. And again, this is something we've been talking about, for it's not a new problem, obviously. So I think there are important sort of thinking to be done around. Maybe this is, I don't know, is it in the strategy? We'll have to see. But that's one of the big things I think going forward. I mean, the challenges obviously are any challenges of siloing and things like that. It's not unique to government in that sense. And I think how do you overcome that effectively? I think one of the things around the household food insecurity dimension is then obviously you also have a kind of income policy, economic policy dimension as well in terms of DWP and the social security system. So, we're just trying to tot up all the different departments of government, thinking which one wouldn't be relevant to these conversations. So I think, but I think there's also a question of framing, and it is important that all of those areas also have a role to play in their own right, and to make sure that those responsibilities are effectively enacted in those different spaces, I guess, as well. And just so, that's another thing to bear in mind, really.
Yeah, thank you. You're right. One of the things that we are keen on in the Institute for Sustainable Food is the way it does cross-cut so many areas, from production to consumption, people's everyday lives, all of that sort of stuff. And we've done a similar job sort of mapping onto the Sustainable Development Goals. And there's almost none of the Sustainable Development Goals that haven't got a food dimension to them. So it really is a cross-cutting kind of thing. I'm going to ask a couple more questions, or part of the discussion, then we'll go to a more general, to the questions that have been coming in, which are great. DEFRA is engaged at the moment in a kind of review of different public engagement strategies, anything from citizen science to digital, online kind of voting kind of systems, public dialogues around food, you name it, lots of different methods. And one of the issues there is what kind of public is being engaged, and are there sections of the public who are not particularly engaged, and if so, what can be done about that? And it may well be the case that the people who are most food insecure are those who are least likely to be engaged in these kinds of public consultations. And then there are questions about why is that? Is that because of their lack of access to internet, or is it because they're not happy with the way in which other forms of public engagement have listened or not listened? Questions of trust and participatory democracy more generally, I think. So I just wondered if you thought the kind of work you've been doing and the kind of departments, national, local and all the rest of it, how have they engaged with the public or publics in this context, and how effective do you think it's been?
A great question. I think so. I think there'd be two sort of observations. One would be in terms of this response. I think one of the things that came out really strongly in our national research with the kind of policy and national policy and practice stakeholders sort of last year was the speed of the response and reaction that was required. And the shielding box, for example, it was and it was unprecedented, and they had to do something really quickly and put it in place really quickly. So there's a challenge there around who can speak into that process in that way, and who's, and I don't know who was in the room for those things, but there is that kind of, in terms of COVID specifically and reacting and response to that, that was a specific moment in time with its own specific challenges. But I think going forward, and it speaks to your other question around, an appetite for change, and what is change and what should we be doing? What do people want? Participation is going to be absolutely critical in those processes going forward. And I think one of the main issues there is what does engagement and participation look like, and is that meaningful? To what extent is it sort of going out and having a chat with a few people and job done, or what is it working with specific groups in a really meaningful and embedded way, in a way that speaks actually to the policy that results? It's one of those fiendish things, I think, engagement and participation, where people have a sense of vaguely kind of, that's good inherently, but what is it? And is it meaningful? And it has to be meaningful to be effective, and for people to engage in it, I think, as well. I think that's one of the key things, but that is difficult. speaking again to those structures that in your previous question, in terms of how does that fit into the policy making process. But what is good is that obviously that there does feel to me, at least, to be a real momentum behind increased participation in all kinds of social science research, in policy making. So we're definitely, it seems, sort of riding the beginnings of hopefully quite a powerful wave. But I think one of the main things will be all of us who are engaged in that kind of work, whether researchers or policymakers, being really reflective and careful of our practice in that space and making sure that it is embedded and meaningful. And then again, this is a political scientist in me, there are power structures here too. So then how does that translate into policy and in turn translate into affecting a global system with very powerful actors at all scales? So it's not easy. And that's one of the other things. It requires a lot of resource, a lot of time, a lot of care to make it meaningful. So it's never going to be a quick fix. It's part of certainly that sort of wider, broader transformation, I think.
Yeah, and I think the National Food Strategy had a public dialogue phase in 5 different parts of the UK. It was going to do it in 2 sets of face-to-face meetings, and then COVID got in the way. So the first phase of that was done face-to-face in those 5 communities. The second phase was all done online. It was intended to end in a big citizen summit. In the end, that was reduced to a 1-day meet, in fact, a 2-hour meeting across those 5 groups. So that's quite an interesting sort of experiment in what happens when you go from face-to-face to online. Do you get different kinds of information? Do people drop out? And one of the questions that we were talking about in that process was managing expectations, which is a polite way of saying you have to promise people they're going to have a big influence on government to get them to engage, but then you can't overpromise and then disappoint them, because that means that another phase of public engagement, their trust will have been lost. So I think there's a lot of really interesting work in this place at the moment. So DEFRA's going to have a public engagement report that should be published in, I think, the next couple of months. Okay, one more from me. I'm slightly abusing my position as chair, but we've got a bit of time here, so, and we've got some questions coming in. You talked about vulnerability, which I've been really interested in for a number of years. And putting it crudely, I think government has had an idea of vulnerability cast very much in terms of sort of black and white. You're either vulnerable or you're not. You have particular medical issues around shielding, or there are clinical things that make you vulnerable, or particular groups like the elderly or pregnant women are more vulnerable than others. But I think you could argue that COVID has shown that that's a fairly limited model of understanding vulnerability, and that we are all more or less vulnerable as circumstances change. So people become vulnerable as a result of losing their job or other circumstances in their lives. And I wondered if you had any thoughts on that, about what we mean by vulnerability and what the COVID pandemic has shown in terms of people becoming food insecure, or hopefully as well moving out of it as well.
So I think there's a couple of things there in terms of the language of vulnerability is something that we have reflected on in the project, because as you say, and I don't know exactly where those terms came from in government, but as you say, it seems that may well have been influenced by that quite medicalised kind of COVID response in a way. Although that was just that would be my kind of reflection on that, and that is challenging in itself. And we have talked around what is the best way to talk about these experiences. I think in terms of access to, in terms of sort of the 4 dimensions of FAO's 4 dimensions is really useful here, I think, because it shows you also the different groups that may be affected by different elements. The danger of sounding too much like a researcher, that more research needs to be done. But there is still work to be done analysing the role of income in overcoming other food access barriers. So to what extent people on higher incomes were able to overcome some physical access to food barriers versus others on lower incomes. We're not sure about how the interaction between the kind of the shielding and sort of moderately vulnerable group, less able to go out of the house, to what extent income overcame those challenges or not. We need to do a little bit more on that. But certainly on food issues. And I think that's why it is helpful, the food insecurity concept is kind of traditionally conceived around the different aspects of access. I think that really helps us to start to understand the different kind of compounding implications of our food access, and geography again. I keep talking a lot about geography this morning, Peter, but physical access to food. So in some of our case study areas, particularly in Scotland, we've got rural Scotland case study areas, and actually, some of the food access issues there in terms of what was in the local shop, could people buy enough there, the impact of some, vouchers, meaning people go to other shops and not the local shops, sort of local economies and their role that they had to play in some of this. And if those So there's that rural-urban geography playing in as well. So it might not just be it's kind of your household circumstances and your geography and lots of different impacts in altogether, I think. Which is, I think, one of the reasons that the question of what is the problem and how extensive is it is still one that we debate, because it's hard to kind of bring it all together sometimes.
Yeah, I think that's great. I think the complexity you've just outlined is one of the reasons that a government's insistence on the kind of what works model is deceptively simple. Does this work or does that work? And to say it might work here and not there might not be the most helpful thing. That's not what government wants to hear, but I think it's the reality. And this whole coronavirus pandemic has really demonstrated that diversity, that difference in experience in different places and among different social groups.
Yeah.
Okay, I've abused my role as chair in having an interesting discussion with Hannah. I've enjoyed it. But let's turn now to some of the questions we've got from our audience. And two address very similar issues. So I'll read them both out to you and then we can go from there. So the first one is, the COVID crisis is often used as evidence that our food system is broken. What is your view on this? So the broken food system is the first one. And the second one is supermarkets and the food industry in general, I think, have repeatedly asserted that their rapid recovery from the COVID shock, the empty shelves you were showing us, is evidence that our food system is resilient to shocks. Is that really correct? So these are two nice questions with sort of opposing views. One is COVID shows us that the food system's broken, and the other is not at all. We recovered really quickly. Supermarket shelves were only vacant for, only empty for a short period for a small number of things, and that shows that the system works. So where do you stand on that?
They're great questions. Thank you for those. I think that the latter question is that is a point that is made. Ultimately we did, things kind of settled down. But I think really what comes out really strikingly from our data is just how important and difficult that time was. And, so my question is, and, we haven't engaged with food industry on this question, so I don't have data on it. So my question in answer to a question is, has enough been done that wouldn't happen again? Because I think, and that's why one of my last points was we do need to focus back on that did happen, and I think there does need to be some work done on has enough changed that wouldn't happen again. I think that's really important, because again, obviously as consumers we can, if we can think back to that time, we will all remember that, but the projects that were helping people in food crisis at the time also experienced those kind of lack of access to food. So I think, it impacted people in lots of different ways. So I don't know. I mean, sorry to put it to you, Peter, but I wonder if you had any broader reflections on your kind of food system side as well.
Yeah, OK, I'll have a go. I think you mentioned briefly the stockpiling question, and were people sort of hoarding because they didn't trust the food system to deliver food. And so there are issues about loo paper and about flour and other, pasta and some other fairly sort of core ingredients. There's been some interesting research on that. There's a nice paper in Appetite about that, which says that this kind of accusation that people went out and bought ridiculous amounts of food and stored it away is probably not true. It argues that consumers reacted sort of in an understandable way if they saw shortages, they bought some more, but there was not widespread hoarding and stockpiling going on. And I think it does reflect on the broader food system kind of thing, the kind of stuff we're doing in the Institute for Sustainable Food, because there is often a tendency to assume it's all consumers' fault, blame the consumer for irrational behaviour. And I think that that issue of a short-term crisis, if that's what it was, it reflects all sorts of other things, like supply chains and logistics, like making sure that shelves are full and that people have a wide range of products. That's pretty much what the supermarkets want to guarantee us. But even simple things like the way where flour was coming from, the size of bags it was packed in, and so on. So part of the crisis over flour was about packaging and the getting things in the right sizes in the right shops. So that's a long-winded answer, really, but I think it does show the complexity of a food system, the logistics that go behind the so-called just-in-time delivery of food to our stores. Most supermarkets don't have vast areas behind the scenes storing food. Most of the food is out there on the shelves. It is this just-in-time delivery, which is their most efficient way of producing food for consumers. But it does make them vulnerable to short-term shocks like this. But I know that people like the Food and Drink Federation would insist that this was a few days when consumers were short of a few ingredients. And their line is that it actually shows they're pretty resilient. They think they did a pretty good job. So there's a debate to be had there, I think.
Absolutely. And sorry, because I think that the point about supply chains is also really important and isn't, we've done sort of household experiences has been the focus of this project, but there is ongoing monitoring by the FAO and others around the ongoing impact further down the supply chain. And I think that is something that we don't bring into this project, but it is, again, like we're talking about the complexity, it's important to link these projects like this to issues like that as well. And I was going to say, actually, the local food systems as well is an interesting question in here. And I know it's a project that some other researchers at the Institute are doing, but within that question over the complex global food system, where did local suppliers and local food systems come into play there? We have had some reports about the importance of local retailers and local businesses and others in sort of supporting over that time. So there's some interesting dynamics across the scale as well, I think.
Okay, thank you. The next question is slightly more technical about sort of terminology, I think, and it asks, what's the link between food insecurity, security and insecurity, and food poverty? So I'm sure you've got thoughts on those terms and which of them are most useful in which contexts. So food insecurity versus food poverty.
Okay, thanks. Great question. I love a technical question. Okay, so the use of the term varies in the UK and also internationally as well. So in the UK, researchers and activists and others use both terms, food insecurity and food poverty. It's sometimes interchangeably to mean essentially the same thing, other times differently. So food insecurity in the way that it's been operationalised in the data collection that I presented here and the work that Rachel and I tend to do relates to that's operationalised in that way. It relates to lack of access to food, primarily due to financial reasons, so not being able to afford food. So that's a kind of that, and that's how the measure of household food insecurity that now the Food Family Resources Survey uses and the FSA as well. I think food poverty is used in similar ways or sometimes in other ways. Other researchers have used it to also incorporate sort of social experiential aspects of the experience of lack of access to food. If you're interested in the term internationally, it's the household food insecurity has been used in the North America and Canada and the USA, so their governments both measure it in that kind of financial access sort of space. But in Europe, where I've been working with researchers who are doing this work in this area, actually there is a variation in the way it's used, because in some European languages, food insecurity is synonymous with food safety. So it doesn't actually make sense linguistically to use food insecurity as a term. So food poverty in those countries tends to be used. So I hope that answers your question. But I think definitely if you're asking this question from a research kind of perspective, I think one of the really important things is to in any kind of research that you're reading, to make sure that you just check back on kind of how that's being defined in the research that you're reading and engaging with.
Yeah, that's interesting because it relates back to the previous question as well. If supermarket shelves are empty, then it's not a measure of poverty that limits your access. It's just is it there? So you could be insecure but not poor in a conventional economic sense.
I mean, if I got a second just to, if I whiz back to, sorry everyone, you were going to get
get a headache.
Yeah, get a headache from this. But I mean, this is a good, so as the definition, the kind of terminology I was talking about was household food insecurity, how it's defined and operationalised in sort of those UK surveys. But this obviously relates to the Food and Agricultural Organisation, the FAO's concept of food security. So this again has all these different elements, and it wouldn't necessarily be kind of predominantly driven by one element. So this is the idea that everyone has secure access to adequate food, not just now but into the future. That's a really important aspect of it. It's secure food access. And you can see here how actually in terms of this household food security element, there are lots of different elements that the UN particularly focus on, which is from my personal, sorry, I touched the microphone then, my perspective is why it's also it is a very useful concept, because it has been really elaborated on in policy circles as well. So, and I think that is key. Slight tangent here, but obviously the UK government do use the food security terminology. Traditionally, it's been much more aligned with an idea of national food supply and food security, but it is a policy concept. So again, thinking about who your audiences are or where your research or policy or activity work is going is kind of targeted at. It's important to kind of understand some of these broader ways in which it's been used. So I actually think this is useful, and as as a researcher, I thought the power of that to apply in a UK context as well at that time was also really useful. So I think there's a lot been, so if you're interested in this area, there has been a lot of work on measurement, on experiences, on research in other spaces around food security that the UN have done that is worth certainly looking up.
So do you think it will be fair to say that the COVID crisis has forced government to take more interest in mapping and measuring food insecurity? I can think back to a few years ago when there were no very consistent measures, and we were relying on things like access to food banks as monitored by the Trussell Trust and others as our measure. And that meant it was very easy for governments to dispute those kind of findings. The fact that people like DEFRA and FSA's Food and Use Survey are now taking an interest in this area gives us more reliable, robust measures, would you say?
Yeah, I mean, I think that's right. Over time, so actually I think we probably went into this crisis when it was quite a high, relatively, in comparison historically, relatively high profile issue, as high profile as it had been in government circles probably. As you mentioned, the FSA have been measuring household food insecurity for a couple of years in their Food and You. They were the first sort of government sort of agency to do anything like that at that kind of level. But DWP announced that they would be collecting data through the Family Resources Survey as well. So there is a household food security measure in that. Rachel Loopstra has done a lot of work on measurement. So she's got some pages on our Enough website, which is enuf.org, which has a couple of pages on measurement and conceptualisation and operationalisation for anyone that's interested. So definitely kind of have a look at some of the things that she's written on that as well.
Okay, we're coming up to the hour, and I think we've got time for a couple more questions, if that's okay.
Yeah.
The first one, I think, is about diversity and uniformity. So it says, many institutions are inventing schemes not related to local diversity, but the result of administrators' mindsets. Is anything being done to achieve uniformity? So this is, I think, about local diversity versus, what the questioner talks about as an administrator's mindset, and what's being done to achieve uniformity.
Okay. So I think, excuse me, I can't speak to all practice, obviously. I think it relates interestingly to the issue that we were talking about, participation. And sorry, that's been kind of key to overcoming some of these issues. Excuse me. So in terms, I'm going to interpret this question and I'm sorry if I haven't interpreted it correctly, but going back to some of the findings that I've presented. So a good example of this, perhaps, and forgive me if I've misinterpreted the question, but a good example of this would be the shielding box scheme, for example, and the reports that because the boxes were standardised, that they just weren't appropriate for all groups and all people, and actually, you know, that was really important in some of the activity at the local level and local authorities and other groups compensating for that essentially in some areas as well, just saying, no, this isn't appropriate, so we're going to provide totally different provision for different groups. Certainly I can only talk to our emerging findings because we've not published the local stuff yet, but definitely what's coming out strongly is that in some of our case study areas, because we had 14 case study areas across the UK, that actually making sure that the support was appropriate for all different groups of people in a local community was a key priority, and working oftentimes with the third sector and doing so, working with community projects and community groups in order to understand what the most appropriate response would be and how to do that, or how to support existing effective responses. So I think I would probably divide that up at a couple of levels, locally and nationally, and from what we can see in our data locally, there's variation in some of that, but certainly in some areas that was a key priority. I think one of the things we heard nationally, particularly with the shielding box scheme, was this point, you know, it was unprecedented. We had to do something. This is what we had to do. You know, this was the best we could do with the circumstances that we had. I think there are some really interesting aspects to your question around scale, again, you know, national sort of government level, to what extent that's what's understood all the way down to the ground, to what individual groups or individual households or individual people kind of need and it's most effective for them. And how do you square that circle? So there's some important questions for us that we've not managed to explore yet in the research is how did all those levels interact, you know, and how effective was that in terms of national government listening to local government? Because it's what's very clear to us, because we did the research sequentially. So we looked at the national response first, then we did the local case studies, and you know, we had this picture of what was in theory available and how it sort of works, but actually the local was so critical to how a lot of that was implemented or, you know, adapted or overcome or replaced, as we're finding. And so actually sort of local actors, you know, were absolutely key. Last thought on this as well is perhaps an element of partnership working. I'm not sure what your experiences are that's also led to your question, but in some areas that we've been studying as well, sort of the questions of how effective the working together is between different community organisations and representatives and local responses as well. I think that dialogue also being key there as well. But yeah, to come full circle, I think looking forward, the questions that Peter raised earlier around participation and how to effectively make sure different groups are represented in sort of responses and designing food systems is absolutely critical.
Okay, thank you very much. And then our last question, which is a really nice one, I think, says, would building back better entail an end to food banks and the reliance on charity, with a real determination to deal with the issues of poverty?
Excellent. That is a very good question to end on. And I think what's been really interesting here is how, and you know, absolutely driven by, in a large part by the community and NGO sector, is actually how we're moving out of this with very high profile organisations like the Trussell Trust and IFAN and others really putting that front and centre, end to the need for food banks. That's what we need to look at, root causes, moving towards a future without food banks. In fact, I can't remember the exact name of it, but there is an APPG for the end of food banks or something like that.
Tell people what an APPG is.
Sorry, Old Parliament Party Parliamentary Group. So it's a group of, it's not a formal committee, but it's a group of MPs coming together on an issue. And I think it's called for the end of the need for food banks or something like that. So there's a really significant push here. I guess, and absolutely, and thank you as well in that question, highlighting the issue of poverty and root causes of kind of economic access to food issues. I think that's absolutely critical. And one thing that my presentation hasn't done here, just because we were only a small team and there's only so much you can do, is actually to talk about the role of the social security system and other kind of income support measures that were put in place at a national level. And absolutely, you know, we need to look at how effective they were and what means to the future in terms of, you know, the uplift in universal credit, what happens to that, what happens to social security going forward. So absolutely. And I think one of the things I would, you know, I raised as well in the PowerPoint, and I guess to leave us with for kind of thinking about is that there is the momentum to move away from the need for food aid, but there is also important questions over the legacy of what we've seen. What I didn't go into detail on here is the scale of what was inputted into the kind of food aid system, for want of a better word. You know, tens of millions of pounds of money going in to support the system and the crisis need at that time. And much of that's been wound down now in terms of government funding and other funding. And, you know, Tesco donated something like £25 million worth for food for the Trussell Trust and Fair Share, you know, unprecedented amounts of money in an unprecedented circumstances. But what is the legacy of some of that? You know, we know from experiences in North America, but also more recent experiences in Europe as well, as to when these structures get created and there's a longevity to them, you know, how do we actually unpick that? And I think, and that is also something that the NGOs are really at the front and centre of exploring, is like, you know, how do we unpick this? And where do we go from there? So I think that is something that we will need to watch. But for me, as someone who's been looking in this space for a number of years now, I think the fact that food banks and food aid responses have been a staple part of kind of the sort of welfare in its broadly, you know, voluntary and, you know, other the kind of what broadly conceived fashion has been there and has become increasingly part of the landscape and increasingly embedded. But, you know, the fact that food banks were on the list of organisations that were critical and had to stay open, they were on that list that night, you know, that is, you know, it's really important to note how front and centre they were to the response in practice, but also in that, you know, in that landscape, in that kind of formal response as organisations that was, you know, lent on and needed, required in their time. So I think that leaves us something to reflect on and goes back to the first question raised by the first people in the Q&A, really, in terms of, you know, what does that say for our food system going forward?
Brilliant. Thank you very much, Hannah, and colleagues as well. It's a really, I think, great example of a kind of acute issue that reflects on all of the underlying systems involved in food system research. So fantastic. And as I said, I think earlier, a really good example of trying to research something in real time as a kind of crisis unfolds and as people respond to it. So that was fantastic. Thank you very much indeed. Can I just remind and thank you to the audience for some really good questions as well. Can I just remind people there are 2 remaining sessions in our Planet to Plate Festival. At 2 o'clock UK time, Siobhan Lambert-Hurley will be talking about her work on forgotten food, connecting history to food sustainability in India through the revival of heritage rice. And then at 6 o'clock UK time, Gareth Roberts will be in conversation with Carolyn Hart about what they call a values-based food system. Thank you all very much.